Hello, let us introduce you the technique of deep gluteal syndrome endoscopic treatment with three portals technique. The first step, we introduce the medial portal where we put the camera. Then we introduce the median portal where we put the instrument, ablator, and we make a release at the area of ischial tuberosity. We clear adhesions and scars at this area. And after visualization of ischial tuberosity, we start to prolong our release to the lateral direction. Sometimes we can meet an inferior gluteal artery in this area, which is located medially from the sciatic nerve. Then we continue our release in the lateral direction. We cut all adhesions and scars at this area and approach to the sciatic nerve and to the femoral bone. Sciatic nerve is located in between femoral bone and ischial tuberosity. Then we create additional lateral portal. We switch the instrument into the lateral portal. Then we switch our scope with the help of switching stick into the median portal. And this gives us better visualization of the sciatic nerve and of this area. We can see the inferior gluteal artery and pulsation of it. Then we go to the lateral release. We cut all adhesions in this area with ablator, continue our release and approach to the sciatic nerve. After visualization of the sciatic nerve, we start performing release of the sciatic nerve and decompression in this area. And after release in this area, we start to prolong our release in proximal direction. This is more safety way to get approach to the infrapiriformis space, not to contact with vessels. So now we continue our release into the proximal direction. We go along longitudinally to the sciatic nerve and we approach to the infrapiriformis space. We can see the rotator cuff muscles of the hip, which are inferiorly from the sciatic nerve. We do the release superiorly to the sciatic nerve, closer to the piriformis muscle. We do a small myotomy of the rotator cuff muscles, of the rotator hip muscles, to decrease tension and to increase the space of infrapiriformal space. Then we continue our release bluntly with the obturator. We can also switch back to the ablator. And our goal is to remove all adhesions and all scars around to the sciatic nerve. We also can make more our release of the rotator muscles. We add a little bit myotomy to decrease tension. And this is the final view of sciatic nerve after decompression. This is the infrapiriformal space. We see it proximally. And this is inferior gluteal artery, which is located medial from the sciatic nerve. And this is the final view. Thank you for attention.